The longitudinal integrated clerkship model creates a dyad between a student and a preceptor in each of the major medical fields.
The medical student that's with me is Seth, and he's awesome. And it's just like having one of my kids around.
I love working with Dr. Ott. I'm with him in the clinic 2 days a month and then in the OR at least 1 day a month. Over the course of an entire year, I think our relationship is developed in a much more thorough way.
So instead of just seeing patients in one episode, one admission to the hospital, or 1 or 2 clinic visits, they're actually following patients over a period of time. This is something that I wish I had when I was in medical school.
Each student will have at least 7 preceptors, and we work to create a framework for the students so that they interact with each of those preceptors at different times and different frequencies through the month.
I was an LIC Preceptor last year and worked with a student over the course of the year, and it was actually a really neat experience. She started off having never done a single rotation in the ED, not really having any idea how the workflow would work, but by the second time she came in, she already knew how to better function in that role. And by the end of the year, she was functioning at an intern level.
The LICs are a great way to infuse into the practice a new set of eyes. We have these new students who are coming in, seeing how care is being delivered, and are giving us great ideas about how we could actually do it better.
Seth, typically, he comes on Tuesdays. He joins me for a mix of conferences, clinic, and rounding. To be honest, I could turn him loose in the clinic and he could do a good H&P and figure out what's going on with the patients.
I can see patients with one preceptor and then see them again with another. And it really helps develop a picture of what the pathway of a patient through healthcare, especially Intermountain, is going to look like.
To be asked by a student, why are we doing it this way, actually helps us to think about how to be better and how to do things better and how to connect with the next generation of patients in our communities.
People can say, well, I don't have time for that. It slows me down, whatever. But every time I'm with a student, I learn from them. It makes me a better doctor. So if I want to be selfish, it's helping me be better at what I do. And then I think it's just fun. I think it's wonderful to see young people who are excited about what they're learning come and go and help them along their journey.
We've all benefited from standing on the shoulders of giants and the mentors that we had. And it's a great opportunity to be able to give back.
We really do have a wonderful team here at the School of Medicine supporting LICs. Our team is really good at communicating between the students and the preceptors in a way that doesn't burden the preceptors, but actually creates a really nice flexible model for the students. We do take the onus on us to create schedules and make it really easy for preceptors to do this.
If you're on vacation or have a medical issue or some other life event, the time commitment has enough flexibility to work with that in the LIC model.
The longer you work with someone, the more you learn how they work and how to work best with them. Working with Dr. Ott as a surgeon, I can see how he approaches clinic, and I can see how he approaches the OR, and I can learn that way and find how I fit in.
This preceptor apprenticeship model where they're with multiple different attendings in different specialties is a great way to learn medicine. This is learning the art by doing it with somebody who knows how to do it.
It's been amazing to see some of our physicians come and say, wow, this is really helping me be regrounded. I was feeling burnt out, but now I feel like I'm giving back in a different way, and they're reinvigorated in their career. I'm really excited about the LICs because it actually is much closer to what it really means to be a physician and what the real world of being a physician is like. You know, really, I don't see any downsides. I think it's actually all upside.